Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. First, the highlights. NAFDAC promises validation results on Moderna vaccines in 72 to 96 hours. Ogun government partners World Health Organization on genomic sequencing for COVID-19 strains in communities. And UK government reviews travel restrictions as France moves to amber list. Nigeria has now recorded its highest daily infection figure of COVID-19 in more than 6 months, according to the Nigeria Center for Disease Control (NCDC). The latest figures has raised the country's total infection number to 176,011, while the fatality toll now stands at 2,167. Cases on admission across the 36 states and the FCT is now over 8,000 cases, with Lagos leading. Hospitals across the country will further be put under severe pressure due to the lingering strike by the National Association of Resident Doctors, NARD, which is now in its 4th day. Here's more on the update.
The third wave in Nigeria continues to hit harder as the country has seen a surge in cases linked with the detection of the Delta variant. However, the NCDC is reminding all Nigerians to take seriously all measures instituted by the federal government to curtail the spread of COVID, including a repeat of the PCR test for all returned travelers to Nigeria to be carried out 7 days after arrival. The country recorded the highest daily infection in 6 months in the last 24 hours, as the NCDC announced 747 confirmed cases reported from 13 states and the FCT. Lagos, the epicenter of the disease, registered the highest figures with 488 cases, followed by Akwa Ibom, which reported 121 infections. Oyo had 29, Rivers recorded 25, Ogun had 15, while 13 cases were registered in Kaduna and the FCT. 11 cases were reported in Kwara, Ekiti and Osun registered 10 cases, Edo had 6, Abia 3, Anambra 2, while Plateau had 1 case. 0 cases reported from Sokoto, Nasarawa, Kano and Ondo, as well as discharges and deaths reported from Lagos on August the 2nd. The latest tally raises the number of confirmed cases in Nigeria to 176,011. 86 persons have been discharged in the last 24 hours, raising the total number of recoveries to 165,208. The agency reported 4 more deaths resulting from complications in the last 24 hours, raising the fatality toll to 2,167. With the recent increase in daily cases, active cases in Nigeria have jumped to more than 8,000, while over 2.5 million samples have been tested so far. 31 people associated with the Tokyo Olympics Games have tested positive, making a total of 353 confirmed cases as compiled by the Games Committee. Over 6.8 million confirmed cases and more than 173,000 deaths have been recorded across countries in Africa. The total global confirmed cases have now surpassed 200 million, while more than 4.2 million deaths have been reported.
Meanwhile, the Minister of Health, Dr. Osagie Ehanire, has expressed concerns that the industrial action by resident doctors is crippling the federal government's efforts at tackling the resurgence of COVID-19. According to the Minister of Health, the Nigerian Constitution clearly spells out the responsibilities of all the tiers of government, and the National Association of Resident Doctors cannot hold the federal government to ransom on issues related to state governments. He says doctors who are employees of the federal government cannot embark on strike because the federal government is not owing them salary arrears. Rather, it's the state government. Dr. Ehanire notes that 5 of the issues raised by NARD that affect the federal government are in the process of being implemented, while the other 7 issues, which are purely state issues, such as salary arrears, should be handled by state governments. The Director General of the National Agency for Food and Drug Administration and Control, NAFDAC, Professor Mojisola Adeyeye, says the proliferation of falsified medical products spiked during COVID-19 pandemic, with the agency impounding 70 of such products between 2019 and now. The NAFDAC boss stated this at an event in Abuja to flag off a campaign against falsified food and medical products in the country. She also said that the testing for Moderna vaccine before deployment is still ongoing.
Flanked by the Health Committee Chairman of the Senate and House of Representatives, the Director General of the National Agency for Food and Drug Administration, NAFDAC, flags off this campaign to raise awareness on the dangers posed by falsified food and medical products. The Director General of NAFDAC notes that the proliferation of falsified foods and drugs spiked during the pandemic.
Because of COVID, what I would call the merchants of death try to use the pandemic. We have a prevalence of about 17% of substandard counterfeited medicines.
Beyond the dangers of falsified food and drugs, the campaign also intends to address some public health challenges, including the dangers of buying medicines from unaccredited sources, drug abuse, and improper food preservation methods.
So we are using a
Away from the campaign, the agency's boss clarifies on why the Moderna COVID-19 vaccine has not been deployed for use after they've been handed over to the government on Monday.
We have been working around the clock in terms of making sure that we do testing on the Moderna vaccines. It may take 3 days, 4 days, but we are trying to shorten it as much as possible. But our goal is to make sure that the product is of quality, and that is what we're going to deliver.
The Chairman House Committee on Health also comments on legislative efforts to prevent the proliferation of falsified food and medical products.
A fine of 5,000 doesn't make any sense to deter anybody from any activities. In the NAFDAC Establishment Act, there are some areas that fine were also mentioned. I want to assure you that when the bill is passed by both chambers of the National Assembly and is assented to by Mr. President, I assure you that it will serve as deterrent.
Under the existing law, persons who falsify food are liable to a minimum jail term of 3 months and a maximum of 5 years with an option of 500,000 naira fine, a penalty that many consider insufficient to deter perpetrators.
And so far, the new COVID-19 variants seem to increase the ability of COVID-19 to spread, but do not influence how sick someone gets from the disease. Well, joining us to talk more about vaccines and vaccine efficacy in the studio is pharmacist Ekanem Nsabasi. Thank you for joining us here in Lagos.
Thank you very much for having me.
All right, I'd like to begin with the NAFDAC campaign against falsified drug. And the NAFDAC boss is coming to say that this campaign will take place in 8 states, but it's something that we've seen due to, the coronavirus pandemic. But for you, and especially this period, how does one identify a fake medicine, a fake drug?
Well, identification of fake medicines is quite simple. And recently, what most manufacturers do is that there's what we call a mass number. So in all products, we have a particular point or place where you scratch, and then you text the number on that product to a particular number on phone, and then you get a message. Now, if the message shows that, yes, the product is authentic, then that product is authentic. Now, where you don't get a message from the manufacturers, that means the product is not authentic, it's fake. And we know that there has been a lot of proliferation of fake products in Nigeria. I've worked in NAFDAC for some time, and I can tell you that the more the agency tries to devise new means of, clamping down these, fake drug producers, the more they devise even other means of, of undermining the efforts of the agency. But I see this effort by the agency under the leadership of Professor Adeyeye. It's actually one that is resolved to clamp them down. So what we are going to be doing that is we are going to be using double approach. So it's going to be from the end user's side with the use of the mass number, and then increase surveillance on the part of the agency, so that we now send people to go into the field, actually go in survey for these fake products. And of course, people who are arrested will be prosecuted, and the law will take its course.
And another thing I'm sure Nigerians want to see is that, there should be this in the hand sanitizers that we use, which we are frequently using because of the pandemic. Also, the face masks that, we see everywhere as well, making sure that they are great quality.
Yeah.
Let's talk about Moderna. It's in the country. NAFDAC says it's undergoing validation testing. How different is it from AstraZeneca, which we've received earlier?
Well, in various ways, it's far different from AstraZeneca. Moderna is about 94.1% efficacious. Compared to AstraZeneca, they're just about 76%. So, and Moderna uses a technology called the messenger RNA. Messenger RNA is a new technology, that really helps, the immune system to develop something that will develop a protein, that will fight off the virus. So in terms of comparison, I think Moderna is much more efficacious. And in terms of even side effect profile, you realize that Moderna, if you look at the numbers, in terms of the side effects, both from mild to moderate to severe side effects, Moderna does far better than AstraZeneca. Nonetheless, the major drawback with Moderna is just storage, logistics. That's the major drawback. But when it comes to, in terms of comparative advantage, in terms of the efficacy, in terms of the safety, Moderna really stands out. It's as good as Pfizer-BioNTech vaccine, and it's very good. As a matter of fact, studies have shown that Moderna is still very effective against the new variants. So that means that we might be looking at something that will help us even when we have newer variants of the virus. So Moderna is quite good. It's much different from AstraZeneca. And for me, it's going to be a very good thing for us to have Moderna vaccines, administered to Nigerians.
And in terms of, it's also 2 doses, Moderna.
Yeah, of course.
How many weeks in between?
No, 28 days. 28 days is fine. Between the first dose and, of course, the second dose is just 28 days. And with that 28 days, 2 weeks after the second dose has been given, there is full immunity, against the virus.
Well, we'd like to thank you for taking your time to talk about this. Thank you so much, Pharmacist Academic Mr. Abbasi.
You are always welcome. Thank you.
Well, moving on, the Ogun State government says it is in partnership with the World Health Organization and researchers for genomic sequencing to map out the COVID-19 strains in circulation in communities in the face of the glaring rise of cases recorded daily. The State Commissioner for Health at a press conference in Abeokuta said this has become necessary in view of the sharp rise of cases from about 7 to 16 per day, with 35 Youth Corps members infected.
There has been a rise sharp in new cases as demonstrated by our graph. The new cases per day have risen from 7 per day on the 15th of July to 16 per day as of yesterday, and it continues to rise. We also have our youths that are in the youth camp, the NYSC camp, also testing positive. The state government, through the Ministry of Health and other agencies, have continued to increase awareness in our communities, and we have continued our community testing in our 5 hotspots local governments. The state is also collaborating with partners like WHO and researchers for a genomic sequencing to map out the COVID strain in circulation in our state. It is well known that a lot of citizens have let down their guards on the prescribed non-pharmaceutical interventions. So at this point, we're urging all Ogun State residents to ensure strict adherence to the public health and social measures that have been put in place.
Still to come, we have the latest trends in the UAE and other parts of the world. Do stay with us. Welcome back. The United Arab Emirates has been taken off the UK's red list, allowing ease of movement for individuals who wish to travel between both countries. Well, this news comes just as the country takes a step further in curbing the spread of the virus. Abu Dhabi Emirates has announced children can now be vaccinated. Our correspondent Mayo Adegoke tells us more about this and other updates in the country.
China's Cyanophone vaccine has now been approved for emergency use on children in the United Arab Emirates and is now available for those who want the jab. Local authorities say the decision to inoculate children aged 3 to 17 follows clinical trials and local evaluation carried out on 900 children with the consent of their parents.
As a parent, I'm indifferent about the vaccination. However, if I know that if I know that I will be traveling a lot, then I will take the vaccination, because I've met some parents that they had to take the vaccination for their children, but they are 12 years old and they were going back to their country, or they'll be traveling a lot. They took the vaccination for their kids, but I'm in a country where COVID-19 rules and regulation is in place. So I don't think I need to take the vaccination for my children.
The Ministry of Education has also announced that vaccination will be required for students aged 16 and above who wish to attend in-person classes. Meanwhile, resident doctors across the country will now be granted the nation's golden visa in recognition of their efforts and sacrifices in battling the COVID-19 pandemic.
With this visa coming on board for doctors, I mean, now we feel part of the society, we feel more accepted, we feel like now we can integrate more, now we can buy our own home, now our children have a future.
Launched by the country's Vice President and Prime Minister, as well as ruler of Dubai, His Highness Sheikh Mohammed bin Rashid Al Maktoum, the initiative is an attempt by the government to enhance the country's global competitiveness.
So the turnover rate is quite high here. Say people just use this place as a stepping stone and then move somewhere else. But now they're thinking of ways, so it can be viewed as an incentive, probably, so to entice the people to stay, to attract the talents and keep them, to keep the health sector vibrant.
The paid visa granted to doctors will also cover their family members for a renewable 10 years, a welcome relief for the medical workers who previously had to renew their work visas every 2 years. From Dubai in the United Arab Emirates, Mayowa Adegoke for Channels Television News.
And indeed, our Dubai correspondent, Mayowa Adegoke, joins us right now. Hi, Mayowa. It must be some news for people in the UAE that after about 188 days, it's finally off UK's red list as the Emirates turn amber. What does it mean for passengers? How are they reacting there?
It's good to see you, Millicent. Now, to answer the question, the reaction, it's one of huge relief, I tell you, because previously what we saw was that people had to go through other countries to get to the UAE or to get to the UK. So it was a really difficult situation. But now with this, change, it's a huge relief. People can travel back home to see their families. It will also be a boost for tourism. Now, with regards to the vaccination, because the UK doesn't recognize certain vaccinations like Cyanophone, for instance, and a lot of people did get Cyanophone here. So what does that mean for people who have been vaccinated with the Cyanophone? What it means as we speak is that they would need to isolate, perhaps in a hotel or, with their friends or family when they do get to the UK for about 10 days. That's what we see may likely happen because it's not clear-cut what would happen since Cyanophone is not yet recognized, so to speak, by the UK government. But definitely, it's a huge relief.
Let's talk about the resultant effect of the vaccination, which has been progressing really fast in the UAE. How is that affecting the virus curve in the country?
So in the UAE, we've been around the 1,500 cases per day, and it's sort of steady at that point right now. But when you look at how many people are getting vaccinated, you'd see that, for instance, over 71% of the entire population, actually 71.48% of the entire population have been vaccinated. You've got 16.9 million doses already administered. And so you'd see that these numbers are actually quite encouraging. In the country itself, people are relaxed, they feel safe. So, and then you have to also consider the fact that the country is open, tourists are coming in. So at this point, I'd say it's a bit steady, but of course, we would definitely love to get back to that point where we were seeing, double digits in numbers per day. How soon we would get there, that's what we're yet to find out.
And Maiwa, in your report, you also said that Abu Dhabi Emirates has said children can now be inoculated. How do parents feel about this?
We would also find out how well they take to this, because it's a new development. For instance, the lady you saw in the report who's a parent here, she's already told you she's not traveling. She feels safe already here. She might not take it for her kids just yet, but there are other parents who need to travel, and they will need to travel with their kids. So I think on a case-by-case basis, parents would need to consider and say, do I want my kids to have this vaccination at this point? But on the whole, what I can say is there's a high level of trust for the government. Same way we saw for the adult vaccination, people did trust the government, and they said, you know what, if the government says this is fine, then we trust our government to watch out for us. And I suspect that this would play out again in this point. But then again, each parent will need to decide at the end of the day what they want for their children.
True. And finally, Maiwa, the Expo 2020 Dubai appears it's still going to happen. I mean, how are they planning to navigate a lot of people coming in and then, of course, the pandemic?
Organizers have announced that there would be two versions of it. There'll be the in-person for people who want to visit. There will also be the virtual version of the expo. So for people who maybe are not here, or you're here and you don't want to be, on ground, you can log on online and be a part of the entire event. We're still yet to find out the entire scope of how they want to go about it. But I've been to the expo site myself, and from reports we've heard, we know that there would be so many measures put in place. Cameras, your hand sanitizers, all of that stuff would definitely be put in place. We await more details on how they wish to play this out, especially when you think of the Olympics and how that's going, especially with people not being there. It'll be interesting to see how they pull this one off. But if there's anything we know about the Dubai government, they always try to go hard and take it to the next level. So let's see what they come up with.
All right, many thanks. It's always good to see you, Maiwa Diguke, our Dubai correspondent. Thanks again.
Thanks.
And fully vaccinated passengers returning to England, Scotland and Northern Ireland from France will no longer need to quarantine after Sunday. On widespread changes to the traffic light system for travel, France is being moved from Amber Plus to Amber. Here's more on the global update.
Britain says that fully vaccinated travellers returning to England from France will no longer have to quarantine, scrapping an extra rule imposed on its closest neighbour last month, as it also opened up to 7 more countries. The government says the change to France status from Sunday, the 8th of August, will help simplify its travel rules and would also allow quarantine-free travel from more places in a boost for the troubled travel industry. Meanwhile, the French President Emmanuel Macron says it is likely that the elderly and vulnerable will need a third COVID-19 vaccine shot and that the country is working on rolling this out from September. Macron's government is trying to step up France's COVID vaccination program again as the country faces a 4th wave of the virus and street demonstrations in protest against government's COVID policies. Over in Asia, Japan has decided to expand its emergency curbs to cover more than 70% of the population as a surge in cases strain hospitals in the Olympics host city, Tokyo, and other parts of the country.
Japan had avoided the explosive outbreaks seen everywhere, but infections are rising fast as new cases hit record highs in Tokyo, with newly reported daily cases exceeding 15,000 for the first time. A new record for cases has also been set in Sydney, Australia's most populous city. Victoria State has also rolled out another week-long period of lockdown after the discovery of 8 new COVID cases. The second most populous city, Victoria, will enter a 7-day lockdown.
Victoria will have to lock down again for 7 days from 8 p.m. tonight. 5 reasons to leave home, school closed, all the same reasons, all the same rules that we are well accustomed to, that we have used to our collective benefit, that we've used to crush outbreaks a number of times, even Delta outbreaks.
It's chaos and confusion at several vaccination sites in Philippine capital region as thousands of people rush to get their vaccine shot before Metro Manila heads back to a 2-week lockdown. From Thursday midnight, the strictest quarantine restrictions will take effect in the capital region, an urban sprawl of 16 cities and home to 13 million people, to limit people's mobility as the threat of Delta variants persists. Residents also queued as early as Wednesday night for vaccination slots amid fear that they would not be allowed to leave home for work if they are not vaccinated.
Remember that the coronavirus can live on the surface for several hours. Continue to take responsibility. You can visit our websites for a better understanding of the pandemic. You can also find breaking news and other stories at your fingertips. It's channelstv.com. That's the program this time. Thank you for watching. I'm Millicent Walker. Stay healthy.